Did you know heart disease kills 1 out of 3 Americans? And for many of these people, they die in their 40s and 50s because they didn't know. So, how do we find out that we have a blockage? For most patients, they don't know they have a problem until they actually have a heart attack. And so, traditionally, when somebody gets a physical, and just about everybody gets their physical every year, we do blood work, we do urine work, we have a conversation with our doctor. But a lot of times, heart disease goes missed. But for people that maybe do have signs of heart disease, like shortness of breath, well, what does the cardiologist usually do? Well, they'll order something called a stress test. And for those that don't know what a stress test is, basically they'll have somebody run on a treadmill. And if they can't pass that test, typically it means they have a major blockage. And they'll send that person off to get some more studies, and usually an angiogram where they go up and they use a camera to look at the artery. And if there's a blockage, they'll perform surgery, like a bypass surgery or a stent. But what if there was a way that somebody could get a test done many years before the heart attack to determine whether they're that 1 out of 3 people that eventually will have a heart attack? And that test exists. It's called a calcium score. And so, what a calcium score is, it's a test using a CT machine and using a protocol called LDCT. And it's very simple. A patient can get this test in less than 5 minutes, fully clothed, without any needles, and it's not that hollow torpedo tube where it caused that uncomfortable feeling of claustrophobia. And the machine can take such detailed images that a radiologist can predict how long it'll take before somebody gets into that heart attack zone. So if you had this opportunity to get this test and you had a high calcium score that was showing that you probably would have a heart attack down the road, what changes could you make? And what would you do different in your life to never get to that point? I advise you to take a chance and get that scan and get that heart calcium score, because one scan can save your life. And if your calcium score is high, well, you need to make changes and do stuff before you get to the point where you get surgery. And if your calcium score is 0, this just lets you know that you're not one of those 1 out of 3 people that's moving towards a heart attack. So I implore, take time today, make an appointment, and get in and get your scan, because one scan could save your life.